Yes, good afternoon, everybody, or good morning if you're on the West Coast in the Midwest. On behalf of the Fatherhood Research and Practice Network, we would like to welcome you to our second learning webinar. And I'm going to scroll to the next page here. Give a little bit of background about the Fatherhood Research and Practice Network. The key team members and committees include two of us here at Temple University, myself and Rebecca Kaufman, who's a Senior Research Coordinator, and then at the Center for Policy Research in Denver, Jessica Pearson and Nancy Thonis. The team also consists of Dr. Vivian Gadsden at the University of Pennsylvania, the Ballman Group, and we have involved 40 leading practitioners and researchers in steering committees and work groups. Today we have a wonderful panel of both researchers and practitioners, and the panelists work together as teams. There's Dr. Jennifer Bellamy, Associate Professor at the University of Denver, Sandra Morales-Mirke at Dad's Matter Project, and Matthew Lee Smith at the University of Georgia, and Yvette Sanchez at the Children's Shelter. They'll be introducing themselves a little bit later in our webinar. So just to go on to give an overview of the FRPN, this is a 5-year grant awarded to Temple University by the United States Department of Health and Human Services, Administration for Children and Families, specifically OPRI. And this grant goes from 2013 to 2018. Our goals are threefold. One is to promote rigorous evaluation of fatherhood programs that serve low-income populations across the country. Second, to provide training and technical assistance to researchers and practitioners. And third, to disseminate information that leads to effective fatherhood practice and research. We serve a broad audience of programs that serve low-income fathers, both Office of Family Assistance and non-OFA grantees, state-sponsored fatherhood commissions, programs linked to Head Start and Early Head Start, programs funded by states, local child support, and child welfare agencies. Some of the gaps that we are planning to address in the upcoming years include increasing the quality, and I should say the quantity, of evaluation research on fatherhood programs, funding research practitioner teams to conduct rigorous evaluations. We're also developing and testing outcome measures for the field, promoting evaluator practitioner collaborations, building capacity among practitioners and evaluators, disseminating, translating evaluation findings, and creating a sustainable fatherhood research network. Thus far, we have funded 4 projects. These were funded last November 2014, and these are projects that are currently conducting rigorous evaluations of their fatherhood initiatives. The first is Dr. Bright Sarfo and Mr. Joseph Jones at the Center for Urban Families in Maryland. Second is Dr. Paul Lanier at the University of North Carolina and Patricia Beyer at Wages in North Carolina. Dr. Jennifer Bellamy, who happens to be one of our presenters today, along with Metropolitan Family Services in Chicago, and Dr. Jung-Il Kim at Baylor University, and Dr. Brenda Oyer at the Ridge Project in Ohio. We are going to be putting out a second request for proposals at the round 2 of our funding opportunities in January 2016. And that RFP will be going out. We will be requesting folks to submit a letter of interest and to submit full proposals. Okay, Hal mentioned that the FRPN is in building capacity in the field. This is being done by developing new measures of fatherhood program outcomes. We're going to be conducting a 1-day certificate program on evaluation research on June 9th at Temple University. That's part of the NPCL Fatherhood Conference that's forthcoming. We also conduct learning communities with researchers and practitioners. We have developed a multitude of materials, videos, and we're in the process of developing new webinars that will be available on our website. We also help programs find a researcher, and in the same vein, we help researchers find a program. And this is especially relevant right now as the Administration for Children and Families, as DHHS, has put out their request for proposals for funding of new fatherhood initiatives. And we also make multiple presentations on evaluation research at conferences. If you would like to contact us, this is our information. This webinar will be placed on our website, and so if you need this information, you can access it very easily on our website. And I'm going to turn this over to Jessica, who's going to talk about today's webinar. Thank you.
Thank you, Jay. So today we're going to focus on researcher and practitioner partnerships, and as Jay notes, it's a very relevant topic because it's a required component of the new OFA, Office of Family Assisted grants, the new pathways for fathers and families. It's also a required component of grants from the Fatherhood Research and Practice Network because we make awards to researcher practitioner teams. There's a lead entity that receives the award, but we expect researchers and practitioners to work together. And what we're going to be talking about today with researchers and practitioners are really how they found one another, how to find a partner, what to expect of one another, roles and responsibilities, areas that issues that are challenging, and success stories, and why it's an important thing to do. First, finding one another. I'm going to go through just a few slides that give you a little bit of overview about these issues, and then our panelists will be revisiting that through a series of kind of interviews that we'll be conducting online now or with them. And first, how to find one another. And we've tried to identify some of the resources that are out there to help researchers find practitioners and vice versa. And one is really through us, through the Fatherhood Research and Practice Network. We now have a listserv, and we have about 800 researchers and practitioners who have signed up to be part of FRPN. So you can sort of put a query out through the listserv. Jay, in particular, works with a lot of researchers and practitioners around the country, so he serves a little meetup or a match-up function. Clearly, you can pursue local universities in some of those relevant departments and research associations. Look for chapters in your geographical area. There are a lot of independent researchers and research firms. The Center for Policy Research, for example, is freestanding, and there are many freestanding researchers and evaluation consultants. So, and in terms of finding a program partner, besides FRPN, the National Fatherhood Initiative has a locator feature on their website. NPCL has a huge membership base, and of course, Fathers and Family Coalition of America also has a large membership base and can help connect programs and partners. We've put down, there are many other resources for help on this, but the WT Grant Foundation has a lot of information on structuring a partnership, developing an agenda, data sharing agreements, and some of the mechanics that you go through in this. Jay and Rebecca, do you have anything to add about that, about finding partners that I haven't touched on?
Yeah, no, not at this moment.
Okay. Now you'll begin hearing more of what salient features about what programs and researchers look for. But I think the size of a program and whether is relevant. It's hard to show program effects with very small programs. The issue of retention is something that I think is of concern to researchers. Attrition, as we know, can be high in programs and ranging from 20 to 40% or sometimes even higher. That makes it, again, hard to show effects because you don't really know what kind of dosage your participants are getting. If you're doing an impact evaluation where you really need sort of a non-treatment group, a group that gets the drug and a group that doesn't get the drug, in this case services, you need enough demand to be able to designate a low-level or a non-participant group. Of course, you want to know that whatever intervention is being delivered is strong enough to have an effect, that it's really a meaningful and intervention so that you can detect outcomes. OFA has strong requirements about the types of programs that they will fund, and any grantee has to offer parenting, relationship, and economic stability services, or through partnerships make arrangements to have those all three areas covered. So that's going to be relevant. Strong counterfactual means that you don't want those who are not enrolled in the program to really be getting equivalent services in the community or through some other source that, again, is going to dilute the effects of your program. Ideally, you'd like to have this program cloistered in a very sterile kind of environment where you can really look at the program effects. In real world, we don't come to that, but you don't want the non-treatment group to be getting the same and identical treatment. So when we also, our researchers will be interested in what type of information is collected, how is it stored, how reliable is information collection, is it good quality. So these are some of the issues I think that are salient to researchers. Panelists will have their own spin on what they look for, but at this point, Jay or Rebecca, anything to add? Or
yeah, if I can just add a few things here, and this is directed, I guess, toward programs and practitioners. When programs meet with researchers to explore the possibility of developing a partnership, I would strongly suggest that you have available for the researcher accurate statistics on the number of fathers that are enrolled in your program. And during the last few years, not just the last year, but during the last few years, assuming that you have a program that's been ongoing. And also information about how many sessions fathers have attended. These are the kinds of things that researchers are going to be looking for when they consider developing a partnership. Also, bear in mind that some researchers have different interests, too, and it's important to know that some researchers may only be interested in conducting a certain type of evaluation, perhaps a very rigorous evaluation that requires a large number of participants. So you want to have that discussion in thinking about a partnership. So just wanted to share those thoughts.
Thank you.
Sure.
These are some points we've come up with that need to be discussed and will inevitably get discussed when you partner up. What each side hopes to learn in an evaluation, the approach, as Jay mentioned, the level of rigor. Is it going to be the randomized controlled trial? Is it going to be more qualitative? Is it going to be more of a needs assessment to find out what clients' services would be appreciated, are required? All different ways, all different types of research. So, and they're valuable at all different types. But there should be a meeting of minds about that. The division of labor and roles of responsibilities, who will do what, needs to be sorted out. You're generally not right next door or co-located if it's an independent third-party evaluation. There may be quite a bit of distance and space between program and researcher, so how do you communicate? How the data will be collected is important. Is it going to be self-administered? Is it going to be questionnaires or forms that are filled out by program staff? Are we using tablets and are we using paper and pencil techniques? Everything is really in use now, and so you really have to fit your method of data collection for your resources and your population. How results will be disseminated and preliminary findings will be handled and presented to programs. And also, I think one area of a big concern is how negative or disappointing results will be handled. And I don't think it's just sort of I think our panelists will talk more about this. It's not just a really yes or no or good or bad kind of outcome. Typically, in a lot of research, it's kind of rare to get big positive findings or big outcomes. They're more subtle. We may find overall no effects in the treatment group, but effects for some subgroup, young fathers or fathers or with certain types of interventions, or fathers with criminal backgrounds or without criminal backgrounds. So subgroup analysis is very important and integral to these studies, and I think should mitigate some of the concerns about negative or disappointing results. Finally, there's a discussion about fees and payment. And I think at this point we can only note that there's a wide range of price tags for different types of research. It depends on the type of study you are doing. In the OFA grant announcement, the cost of a local evaluation, the approved budget allocation ranges from a low of $35,000 a year to a high of $400,000 a year. It depends on the size of the grant, and they have said that the amount you should spend on evaluation ranges from 10% of total program costs to as much as 20% if you're doing a randomized controlled trial. So it's not a one-size answer about what the evaluation will cost. Again, Jay, Rebecca, anything to add here?
Yeah, just one suggestion also, and that is in addition to having a discussion with the researcher and practitioner before firming up the partnership, I think it's a very good idea for the researcher to come and observe the program. There's an awful lot that you can learn about the program by spending a few hours observing perhaps classes or groups taking place, or maybe a case management session. I think would be a helpful way for the researcher to get a sense of how the program works.
Okay. Finally, we wanted to present an example of how the duties associated with a program evaluation might be divided. This is based on the PACT evaluation, which is an evaluation that Mathematica Policy Research is doing with 4 fatherhood programs. And they have outlined a list of the duties that have to be, or tasks that have to be accomplished, and who does what. Again, there's no, this is not canon or law. This is just how one evaluation network divided responsibilities with our FRPN sites. There's some similarity here, but I think most researchers in our projects now are finding they are very involved with the issues of recruitment and retention, and it's not sort of it's pretty engaged. It's not a hands-off kind of lean back and smoke your pipe until all the data are turned over. They're more engaged in that aspect of it. Conducting follow-up data collection is often done by the program and not by the evaluator or the researcher. So these results can this division of labor can look different with different projects, but this gives you an example of sort of how it can be divided up. And we will soon be hearing about how others have divided it up. Any additions at this point?
No, not at this time.
Okay. So now let's turn to the fun part of the program and hearing from the field. And we have two teams that we're featuring today. These folks have worked with each other, and as well as they've had other partners in the course of their career, so they'll be drawing on all of those. But I want to allow each of them a few moments just to introduce themselves, and then we're going to pepper them with some questions. So I'm going to start with Jennifer. Tell us a little bit about you and your research.
Sure. Thanks, Jessica. So I started in fatherhood work actually on the service provider side of things with the Texas Fragile Families Initiative, and then started into fatherhood research later in my career and have been building up to testing interventions really designed to enhance child and family services that have traditionally served moms to better engage and target outcomes that are relevant to both fathers and the co-parenting relationship in particular. So most recently, I am working with a colleague at the University of Chicago, Neil Guterman, to test a enhancement to home visiting services, an example of an intervention that's usually targeted moms, and adding on some modules, if you will, targeted at fathers and co-parenting designed to be folded into home visiting services. So that is the project that's supported by FRPN, and in that project we are seeking to recruit a total of 200 fathers and 200 mothers into a randomized controlled trial. So half of the participants are receiving home visiting as usual and half are receiving enhanced home visiting with our intervention called Dads Matter, and we're following those families from baseline to 4-month follow-up, and then we actually have a long-term follow-up at 1 year. And I'm giving you that background so that some of the comments that I make later in the question and answer make sense.
Okay. And Sandra.
Hi. Yes, my name is Sandra Morales, and I work with Jennifer on the program that she just mentioned. Just to add to what she just said, we are working with 5 different community organizations. That's our partnership. I coordinate the research project. We also have a clinical coordinator, and the name of our project is Dads Matter, and we are based at the University of Chicago.
Great, thank you. And Matthew, you have a long career doing research with various types of programs, fatherhood and otherwise, yes?
Absolutely. Hello, this is Matthew Smith. I am on faculty at the University of Georgia and also at the Texas A&M Health Science Center in their School of Public Health. I have been trained as an evaluator and survey methodologist, so a lot of my interests really surround developing and implementing and then evaluating different types of programs at various levels, whether they be clinical, community, or even more policy related. So a lot of my work truly is with various community agencies. I have been working with pregnancy prevention for both mothers and fathers for many years. and looking at a lot of other health risk among that population. Working with wonderful groups like the Children's Shelter, I've engaged in a couple different evaluations, many of which have been wildly successful, which you'll hear about later. But I think I'll leave it at that for now.
Thank you. And Yvette, tell us about you and the Children's Shelter.
Sure. Hello, everyone. My name is Yvette Sanchez. The Children's Shelter is over 112 years old. We have a continuum of services ranging from emergency shelter services, foster care adoption, as well as our family strengthening programs, which is our prevention programs where we work on the ground with parents. One of our first projects we did was about 4 years ago through the Office of Adolescent Health, which back then was Office of Adolescent Pregnancy Prevention, pregnancy programs. And we worked with an evaluator, which we'll talk a little bit about later, to look at our program and our wraparound services that we are providing to pregnant and parenting teens to see if they had an impact on their self-sufficiency, child abuse, subsequent teen births. So currently, right now, of course, we have a Compadre program, which is a fatherhood program serving male caregivers with children of any age. And that's really what our concentration is right now, is to evaluate.
Fine, thank you. Good. Okay, so now we have. I'm going to feed you some questions and ask one or more of you to respond, but feel free, others on our panel, to jump in and add. So Yvette, how do you find evaluators? How do you meet up and fall in love?
All right. So this is Yvette again with the Children's Shelter. And as I mentioned before, about 4 years ago, we were working with a grant that we had through the Office of Adolescent Health. And we actually were working with an evaluator, but we needed some further assistance to kind of take it a step further and do conduct some research, additional research, and then also some articles. We wanted to see some results on paper, and we met Matthew through a mutual colleague, somebody that we were actually working with, and we set up a meeting. We actually drove. He was actually in San Marcos at that time, and we drove over there, and we kind of had like a pseudo interview. We met with him. We saw his enthusiasm, and he was really vested in the population. So we automatically knew that he was a good fit. So we actually found each other through a mutual colleague, and it just kind of developed from there.
Okay. And Jennifer, how did you find the 5 programs that now you're working with in Dads Matter?
Yeah, we actually spent a lot of time thinking through which potential partners we would approach. So even before doing that interview, I like how Yvette describes that, we actually did a lot of searching on the internet to try to find annual reports to get a sense of some of those issues that you outlined in an earlier slide, the size of the program, how many parents were served. We knew we needed a relatively large pool of potential participants, so we were able to do that. And we also were looking for information about how well established these programs were. I think both myself and my partner had the experience of working with agencies that were really just struggling to survive and wouldn't really be well positioned to take on the additional burden required in partnering with us to do a research study. We also, much like Yvette described, used our network. Since we were based out of School of Social Work, we actually have a field office because students are placed for internship at some incredible number, hundreds of different social service agencies in the Chicago Metroplex. So we actually sat down with them using data we'd pulled off the internet, plus our own personal experience partnering with some of these agencies in prior work to come down with a really narrow list of folks to sit down and have that interview with. So we were using multiple points of data and then that first interview to determine, if people were interested. And also, interestingly enough, just that initial effort to call or email someone seeing how they responded to us. Some took several days to respond, or several tries. The communication was not good from the beginning. So those were just some additional things we looked at.
So it's that enthusiasm factor that Yvette talked about that works both ways.
Yes.
Any other meetup stories or idea from a panelist, from you, Matthew, or Sandra, about that you want to add to it? Okay. So then I want to ask sort of, well, what did you really want to learn? Why do a program evaluation? Is it because it's a requirement of a grant for funding? What's the motive behind this? So Yvette, why does the children's shelter go for evaluation?
Well, we started our compadre program back in 2008, and we typically, or sometimes it's probably very similar in other communities, is we're very saturated in female or motherhood programs, just targeting mothers. And so when we started our compadre program, we thought, okay, this is actually a niche that we have not really focused our attention on. We had lots of programs serving moms, and so we initially received funding from the United Way of San Antonio and Bexar County to serve 40 dads in the first year. When that 40 dads turned into 75 dads, and today we're serving over 400 dads a year. Mm-hmm. And so, over the past couple of years, we've had several different communities approach us and ask us, okay, well, how can we replicate this in our community? What kind of model are you using? Why is it working? And so that's really why we're looking at evaluation. Is we really want to see for ourselves what's working and what needs to be tweaked. We also want to look at the different components like recruitment activities. How are those linked to better participation? Also about our outcomes, our ancillary services for participants. We want to look at retention, what keeps them coming, and also what keeps them participating as a mentor ongoing. So there's lots of little things that we want to look at to really package our program and to be able to replicate it in other communities, so that way we can give them our model and say, here, we know this works, so here it is.
So it's really, in your case, much of it feeds into your trying to refine your practice, and it was started or was motivated by a new area of service that you were not in as much of an established area.
Correct.
Have any of you seen in other partnerships with other clients? What are the other motives that programs seem to have for going into program evaluation? Matthew, have you seen that in the other teen pregnancy area? Other reasons why is it because it's required for funding, or why do they get into it?
No, absolutely. There's a lot of times that it is required, and that you'll see a lot of organizations, and that's why they want to find that evaluation partner. However, the ones that really want to learn more about the effect that they're having, the impact on the community, the ones that really want to refine their process or make a better quality program, those are the fun ones to work with. So a lot of the different groups I've seen have been really looking to make sure that what they're doing has value, has meaning, and so that is something that's very interesting, especially when you start thinking about utilizing funds and whether or not you can either deliver a similar program for the same amount of money that can be more effective, or spend the same amount of money on the same effectiveness of a program but reach more humans, so scale up. So sometimes there's different purposes. Another purpose that I've encountered before as well is to make sure that the program and the outcomes align with other organizations or funding groups' requirements, or I guess more or less their preferences or their outcomes that would be meaningful. For example, graduation rate or lack of arrests or certain types of other benchmarks, so that then they could be competitive for future funding. So there's a lot of different reasons.
And so you're looking at motive and interest level of client. I mean, the interest in outcomes or an interest in using evaluation results and really learning from it in choosing a program partner and a successful partnership. Yeah.
Well, sure, but I mean, I was only addressing kind of what other individuals have been looking for when I guess I've been sought out. But when I'm thinking about what I'm looking for in a partner, a lot of those are really important. You really want to have that mutual interest in a project. You want to have that deserving community in a program that's actually going to be capable of making some sort of impact or change. So a lot of times when I take a look at a program, when I think about forming a partnership, I really want to make sure that the project is going to be meaningful and that the program elements are sound, that they can actually do what the organization thinks they can do to make a change. A lot of times when I think about organizations, I look at their track record. For example, the Children's Shelter has been in existence for over 100 years and has been offering these programs for quite a long time and are a capable organization of being able to continue doing that. And sometimes what you think is, even though as an evaluator you really want to be in on the ground level at the beginning of an initiative, the issue is that a lot of these programs have already been in existence and, the horse is already out of the gate and trotting down the street by the time the evaluators come to play. So a lot of times it's kind of, wrapping an evaluation around an existing entity to really give it definition, to see what it's doing, see how those processes and procedures can be refined to make it more efficient and even more effective. So that infrastructure and that delivery capability from the organization is extremely valuable. But also when looking at an organization and seeing if they are a good one to partner with, a lot of times what I'm looking for is, do they value the evaluation? Can they enable an objective type of evaluation, allow some autonomy? But really what I'm looking for is a partner. It's not that one of us works for the other. It's a true partnership, and that we both have value and that we both can, quote-unquote, negotiate to make sure that we can meet the objectives, the goals for success, and really make sure that we can work with the other partners that this organization may have in the community and overcome any of the politics, because we all know that happens in communities as well, but really come together and create plans for future and vision.
Jennifer, did you go through a lot of programs to come up with your 5? I mean, were there 5 that you rejected and considered, or more, or?
Yeah.
Okay.
That's a great question. So the answer is yes. We had a couple of potential partners that we approached, and actually they just flat out told us no.
Really?
Which sounds perhaps negative at first, but really we were appreciative of their consideration of their own ability to take on this partnership at this time. So for some of them, it was they had already been involved in significant evaluation efforts.
So it was kind of evaluation fatigue?
Exactly. They were, or they had actually agreed with another evaluator not to engage in any new services.
Okay.
Because they were currently being studied sort of, as Matthew was explaining, sort of somebody else was already wrapping their arms around them.
Yeah,
so
right.
we were asking them to take on not only the evaluation, but a new service that we had designed. So I think in some of the scenarios that we've been talking about, the program has developed its own intervention or curriculum or approach that they want an evaluator to test. In our case, we had an intervention. We needed partners who were willing to take that on as well as participate in the evaluation. So it's a little bit of a different scenario. In other cases, it just, like I said, the communication, what seemed to us to be a lack of motivation was such that we decided it probably was not wise to move forward with that particular organization. So we happily, out of our pool, were able to get enough partners to anticipate meeting our goals for recruitment.
But both of you have talked about sort of having some amount of scale, being a sort of above subsistence level in a way, right? Or to be able to take on new evaluation responsibilities. Does it add extra work? Is that something that programs need to consider?
I do think so. This is Jennifer again. I think that sometimes it's not clear from the outset exactly how burdensome that will feel. Our team thought really long and hard about the division of roles and responsibilities in terms of what we would take on versus our partners, because we wanted to try to keep that in check for them. I think the most burdensome part for our project in terms of our partners is asking them to continuously report on the number of families that are coming in for services and whether or not they meet criteria to be included in the evaluation. And staying on top of that every month, even if families don't meet the criteria to be included in the study, has been a challenge, and also training and retraining new staff as programs have turnover, staying in communication with us, and collecting fidelity data. So we're also asking programs to give us data about how they are delivering services so that we can make sure we're clearly distinguishing the treatment group from the control group. So it's a lot of reporting, and that can feel burdensome to some and difficult, and it takes a while before the fruit of that labor is apparent.
Yvette, what about you? Are there burdens when you're doing evaluation or part of evaluation project? How do you experience that? Hello? Hello? Hello?
Hey, Jessica, I'm not sure that Yvette's on the line.
Oh, okay.
Yvette is on the line. She might be muted, but
Yvette okay. Well, let's move on. Okay. And let me ask about Matthew. What about dividing? We put up. Jennifer started. I want to talk about roles and responsibilities. We put up an example about how the PACT evaluation sort of in Mathematica sort of divided duties and responsibilities. What's clearly, when you do projects, in the province of the program, what's clearly in the province of the researcher, and what's sort of less defined and up for, everybody pitches in.
Absolutely. So I think I might be, somewhat unique depending in that I really like to be hands-on from the very beginning, and I like to be really involved. And most evaluators do. They want to know what's happening from the beginning so that they can help to guide that trajectory. So, oftentimes we almost sit down and we do like a show and tell. We want to assess the curricula. I want to know what it is or the main elements. What is it that is really supposed to happen? Why is it that we can identify what would be successful from this initiative if we were working together, and really start to think about the delivery processes, the procedures, the dose of the intervention, but also just how is it that we're really going to make this really effective, and how is it that we're going to be able to identify that effectiveness. So after we kind of come to that mutual, kind of understanding, we start to divvy up the roles. And I think, what you showed earlier is, a great kind of template of what you could see typically. But what I also say is that oftentimes there is a need for training. Oftentimes when you're asking an organization that might not be staffed or resourced to be able to do some data collection or consenting or data entry or how do we transfer the data, there needs to be training around that. So a lot of times I will provide that training if in fact me or some of my evaluation staff would not be on site. I also think that there's oftentimes a lot of need for technical assistance, and that means as we go, as we have these unforeseen events, and it's kind of like predicting the unpredictable. What is it that we can kind of plan for, but as these events come up, how is it that we can help train, retrain, especially as there is turnover, as was said, but then making sure that then you start thinking, well, this is where it gets a little blurry. What was already identified as what the organization would do, all of a sudden the evaluator or researcher is starting to do, and at some point when both parties are really invested, it's okay to go ahead and blend, and you will see that they'll be taking on each other's roles, as long as it doesn't compromise the true integrity of the study. Because then, when you think about the researcher, you think about the data, the IRB, Institutional Review Board. Do you have to ethically protect these human subjects and make sure that you have all of that paperwork, but as it starts to get down to consenting and data collection and the true measurement and management of the data and entry, analysis, reporting, that's where, it really shifts over to the researcher or evaluator, making sure that those are clearly delineated and making sure that a timeline and expectations are really noted, because the organization has their own needs for reporting, whether or not it is for their funder or for their board, but also in addition to that, a lot of times the funding is just to make sure that the program is not drifting, it's not going rogue, and that we can make some midstream corrections if we need to.
Jennifer, is there anything more about division of labor that's been, you emphasize training and retraining staff, and that's with respect to client recruitment and enrollment? Is that been something you've had to get involved with?
Yeah, I think that that's something that we've thought a lot about in our project, is that I think many of us think about the initial training. So we had clinical training, getting folks to learn how to do Dads Matter, our intervention, but also training them and providing supports into how to do the data collection, how to reach out to potential participants and explain the study to them. So we did a lot of initial training to get people up and running. But then, we have found that there's a need to continue that training, not just for turnover, but as people start to implement both the intervention and the research procedures, new questions come up. People find that they didn't understand the process as well as they thought they did.
Right.
In some cases, our teams didn't have an eligible participant for the first month or so. So it had been some time since they did that initial training. So Sandra in particular is just has done a wonderful job of touching base with teams individually and in person, somewhat similar to what Matthew was describing. For nothing is a substitute for going to visit with the program and spending time with them. And I think that's been true in terms of the training as well, and making sure that the support we give to our partners fits the individual needs and circumstances on the ground for their agency.
So, Sandra, what do programs look to want by way of technical assistance, or what do they need the researcher to do that and need help with that stands out in your mind? Is Sandra muted?
Oh, I'm sorry. No, you know what? I couldn't hear what you were saying. I'm so sorry. Your voice
that's okay.
Was in and out. I'm sorry. I missed what you said previously to saying my name. I'm sorry.
Oh, okay. No problem. I'm asking just of what what stands out? What type of technical assistance? What kinds of support do programs need from the researcher in order to be able to pull this off successfully? What kinds of help do you see programs needing?
In our case, what we have found, we work with 20 different teams from those 5 organizations. So we have, I would say, around 125 home visitors who are working with us. They help us recruit families, and then they report the work they do during home visits to those families. And they have families that are enrolled in the study at different points. So what might happen is at the beginning of the study, for instance, we have very few of those home visitors involved in the project because they are actively recruiting families, but we have a lot of other home visitors who are not involved at all. So they are, because they are not following what's happening with the study, at some point when a family becomes involved that they're working with, that's when everything is going to become relevant to them. And that's when we probably will need to review what the screening process is all about, what the eligibility criteria is, how they need to fill out the forms, again, to report their work. So this is on an ongoing basis.
Yeah.
For us, it has required to be in constant communication with them, via email, over the phone, sending reminders, keeping detailed information about who has families to track, a lot of details.
Okay.
Also helping them become more comfortable with recruiting families, how to actually do the recruitment, how to explain the study. It also, we have also encountered that not everybody feels comfortable with recruiting families. They are hesitant. They don't know how families are going to react. They might be concerned that the participating in the study is going to somehow have a negative impact on the relationship with their clients. So, constantly revisiting this information with them.
Right.
So that's part of what we do on a regular basis. Okay,
so there's recruiting for a program, but when you're trying to get program participants to be part of a study, there's an extra dimension of recruitment that can be uncomfortable and cause apprehension. And I think everybody has said that initial training is important, but that doesn't do the job. Somehow you have to keep the program visible to everybody, and the recruitment and the intake process visible, because everybody's juggling a lot of other jobs and duties, and you forget, unless you're doing something routinely all the time, you do forget, and you need refresher training and communication. I guess you were alluding to that, Jennifer, the need to monitor and keep the research goals very, very visible to everybody, yes?
Yeah.
Ad nauseum, yes? Yeah. Certainly continually. Matthew, you had talked about some ad hoc things or unexpected things that come up. Did you ever have to change your research plans midstream when you were working on an evaluation, or make kind of adjustments to the evaluation because of realities of what was happening on the ground at the program, or did it all go according to the written proposal?
Well, I don't think it ever goes exactly as is written. And so I think the question you're asking is, how do you expect the unexpected? And really what it comes down is kind of playing a what-if game earlier. What if we can't necessarily reach the right individuals? What happens if we can't necessarily enroll the number that we need? What happens if they come to the program and they stop coming to the program? What happens if we do this evaluation and we determine that we're really not making the changes that we think we're making? So you start thinking about these things, and you start thinking about, what happens when somebody turns over, or what happens when a vital community partner drops out, or what happens when the funding goes away. So we start thinking about all of these things in advance. And trust me, if you can think it, it has gone wrong. We have these problems all the time. And so really what it comes down to is, yes, in midstream you do sometimes have to change. What you need to think about is if you have a set evaluation, for example, it's a randomized control trial, you need to make sure those elements are really going to maintain, because if you start to change things too much, start to modify the program, or one of your arms of the study doesn't necessarily meet the needs, or it's not conducted the way that you thought it was going to be, it can actually compromise the overall initiative. So sometimes you have to think about the things that you can change and the things that you can't change. And that might mean that on the fly you need to think about, how can you get more participants? Can you expand the eligibility?
Mm-hmm.
Can you prolong the timeline?
Mm-hmm.
Because in certain ways you can't necessarily change everything, because, like I said, it will absolutely collapse the evaluation that you have in place. So you have to think about those things that are a little bit more modifiable. And sometimes you're up against the clock with time commitment. So can you expand the recruitment so that you can do the same recruitment, the same volume in the same amount of time, or can you go ahead and allow the recruitment to happen more naturally and expand the timeline? So there's kind of scenarios where you could play either of those out. We've had a lot of different situations where we were really reliant on other community partners. It wasn't the organization entirely. It was actually the one of their partners where they were either getting a service or they were getting referrals.
Right.
In that instance, when they had their own troubles and they had to change their focus, all of a sudden our organization, our evaluation became secondary.
Right. So it's a domino effect, and you can't control all of that.
And you can't control that. So what you have to do is contingency plan. And again, there are 3 different options. What do you do? Do we find a new community partner? Do we come up with more money? Or do we change our timeline?
Right.
And so again, there's pros and cons to each of those decisions. But as I've known, and as any evaluator knows, just because you've evaluated a program does not necessarily mean that it's the same any other time that you ever evaluate a different program.
Right. Does anybody want to add anything to that, kind of changes in either program or the evaluation that you have to make that's sort of unplanned and not in your original protocol, your initial game plan?
This is Sandra. For the Dance Matter project, specific change that we needed to make was the timeline. We needed to extend the period of time where we began to receive recruitments, the launching period. The referrals started to come in at a slower pace than what we anticipated. We started the program in November. By February, only 7 out of the 20 supervisors were actively recruiting families for us. Even now, we still have a few supervisors who are not actively recruiting. So those are, some of the things that are going to come up later. And adding to what Matthew said, I think that understanding the dynamics within the organization, who is involved in the project, accountability, in levels of engagement, because not everybody's going to be engaged at the same level, is very important because of those scenarios that are going to present themselves later on. When something comes up like referrals are not coming in, who is the person that you are going to, and how can this person change those outcomes, All of those things are important when you're thinking about partnership. We also needed to expand our eligibility because we realized that if we continue to recruit pregnant women on the 3rd stage as opposed to at any stage of the pregnancy, we were going to miss a lot of the clients that were coming into our partner organizations for services. So those are just a couple of examples of the things that we needed to change.
Great. I'm going to abbreviate, select a question or two, and then open it. I want to give time for people to phone in questions, but I wanted to ask Yvette to talk about any concerns that you or your staff have had about an evaluation, and what some of those were, and how you dealt with this with the researcher? Were there any sensitivities or concerns about negative results, or being discouraging agency services or the delivery of services because of the evaluation?
Mm-hmm. All right. Again, this is Yvette Sanchez with the Children's Shelter. First, I want to say that there has to be transparency between the staff and the evaluator or the researcher. I think for us, staff are usually initially concerned that somebody's going to come in with like a gotcha attitude, like looking for all the wrong things that they're doing, and so they're a little apprehensive at first. But you really have to, or what we really had to do was talk to the staff, put them at ease, and educate them on why this is important. Why do we want to look at an evaluation? What is it going to do for us, for the clients, and for the community? And to obviously to get that buy-in and to educate them. And then the other thing is the concerns had that is staff would say, well, the evaluator may not know our clients, may not be culturally sensitive to them. So really having the evaluator get to know the staff as well and our clients, I think that's really important. So basically, the biggest concern they had was just that, the transparency, and then, you're building trust with somebody else who's coming into your work every day.
Right. I don't think, all of us would be apprehensive about having a mirror held up all the time.
Yes.
And, but what about from the Matthew and Jennifer? How do you deal with that? And do you pick that up, that kind of apprehensiveness about, outside experts coming in and judging us, or maybe affecting my evaluating my performance?
Yeah, this is Jennifer. I think that definitely comes up, I think it plays out differently at different levels. So in the process of finding our partners, reaching out, initially we had conversations with folks at the administrative level who had maybe different concerns or hesitations than folks who are at the mid-level program manager role, or those who were on the ground delivering services to families. So I felt as though we were addressing concerns as we got to know agencies, and addressing different concerns at different levels. So administrators might be concerned about the amount of time that staff would have to put in training days or other activities that would take away from billable hours, for example. Mid-level managers might be concerned about how much supervision they were going to have to do in addition to their standard practice to integrate the new intervention. And folks on the ground might be really concerned about how the research, like someone said before, would impact their ability to provide services in a manner that they thought best. So I think it's all of these things, and that the efforts that you make to help people feel more comfortable, to get to know you. I think building relationships at all of those levels and in person is great, and to continue to nurture those relationships, circling back to administrators to report back on how things are going, and offering to troubleshoot for mid-level managers and so on, and really trying to make yourself at service to these really important partners. And we try to say thanks in every way we can. We try to provide fun incentives. We do drawings for people to try to keep them engaged, and so that not every message we send to them is, please send us your data. Sometimes we get to say, congratulations, you won the prize this month. So that helps. Right.
Well, that's Matthew. What about keeping program staff enthused about research after some of the initial, the joys of the initial start have worn off and you're sort of slogging along? What do you do?
Sure. Well, as was mentioned earlier, I think that frequent communication can be really energizing when people are giving very brief project updates and there's regular communication and you start to see the progress. It can really give that new life as the program is continuing. But I also think kind of to the last point as well was a little bit about making sure that the organization understands a bit more about why the evaluation is so important. And when you start thinking about feeding back some of those findings, and if you don't do so just at the end of the project, you actually give those findings for different audiences throughout, you'll see that the participants love to see that they're making progress, which then in turn makes the staff members much more enthusiastic about their efforts, that they're having value, they're having meaning. Again, making sure that those results are shared with the administrators and the project staff as well, and that they understand up front that the evaluation is not to pinpoint problems, but actually to show value and to really go ahead and make their lives easier. You can do this program, you can operate it or execute it more effectively or efficiently. Is actually a really great incentive for people. So by giving a little bit of time, you can actually save a ton of time later. And so I think that, just making sure that the conversation about what type of evaluation is being done and what can be learned from that evaluation for various people in the organization really makes for enthusiasm, and making sure that you create a reporting timeline that enables that enthusiasm to be supported with outcomes.
Great. I'm going to skip over. If we have time, we can come back to the more global stories of success and failure, but I think it's time to really open this up to questions and give people an opportunity to ask our panelists. If you want to direct it to a particular panelist, please specify. If not, let's open this up for questions on any of the topics we've raised today about finding partners, establishing a relationship, designing an intervention, writing a proposal, dividing up the duties, using the information. Okay, Jay, are you going to?
Yes, I'm going to moderate.
You're going to moderate questions, and
yes.
Thank you.
Okay.
Any questions from the audience?
All right, well, I'll open up the line for questions. Ladies and gentlemen, the floor is now open for questions. If you have a question, press *1 on your telephone keypad at this time. The questions will be taken in order they were received. If at any time your question has been answered, you can remove yourself from the queue by pressing 1. If you are using a speakerphone, we ask that while posing your question, you pick up your handset to provide favorable sound quality. Again, ladies and gentlemen, if you do have a question, press *1 on your telephone keypad at this time. And please hold while we poll for questions. Well, it seems right now everyone must have been very informative, as I'm not seeing any questions. So, ladies and gentlemen, you do have the opportunity to be the first question. Oh, and we do have one coming from Martha Brock. Martha, please state your question.
Hi, I am just starting in the process of trying to get a grant, and so all this stuff is new. I'm online looking up the information, and so I'm doing everything at once. What would be your suggestion at that point?
Matthew, do you want to address that?
Certainly. I think that if you are really looking at the grant and you know what announcement you're wanting to reply to, you really need to kind of look at those different elements. And what I sometimes recommend, because a lot of these different requests for proposals are quite lengthy, is maybe create a separate document of just the subheadings or just the meat of what it is that's being asked. Then you can go ahead and you can start to think internally how your program would fit, how your program and program staff could start to answer some of those general questions, the background of the organization, the program, logistics, etc., and then go ahead and identify based on what their outcomes are, what the funding announcement is really looking for. You can then try to identify some evaluators. Go and find whether it is those different recommendations and resources that were shared before, but find people with the true training and expertise, the qualifications that you're looking for, and invite them in to review the request for funding, review some of the materials that you've put together so that they can better understand what it is that you have to offer and what the program is, and then go ahead and see whether or not they would be able to contribute, and then start that whole process of the interview, so to speak, with a little show and tell.
Great. That's a wonderful suggestion. Thank you. I never thought about inviting them in at that point. So thank you.
Martha, for your question. We do have another question coming in from Marianne Porterfield. Marianne, please state your question.
My question is regarding we actually have identified a grant opportunity and want to be able to apply for it. But the organization that I'm with is a 501c3. It's a smaller organization, and so this would be our first time going out for a very large grant. So what we're trying to really determine is, would we be better positioned to let a larger agency that we're partnering with be the lead, or should we just take this opportunity because it is specifically the organization that I'm talking about, the smaller organization. Their specific target audience is about fatherhood and families, whereas some of the larger organizations have a more global approach. So we're trying to decide whether we should be the lead agency.
Yes, thank you. And Yvette, would you be willing to respond to that?
Sure. I think for us, generally, we have about 150 employees, so we're a medium nonprofit. But I think because we've had the program, we have not been afraid to apply as the lead, as long as your partners are very strong, as your collaborating partners are. We have collaborated with United Way in the past for proposals, which is also great, and then also a local university is also what I would recommend for smaller starting out organizations, is to try to network with a university or their local United Way if they have one.
Okay.
This is Matthew. If I could complement that, I think, a lot of times there's territory and people want to have ownership, and I think that's great, and what Yvette said is perfect. There are so many different partners to be had, but I think the key is who can write the strongest proposal, because if you can't get the money, it really doesn't matter.
Right. Okay.
Mary, does that address your question?
Well, it does, and actually, to follow what you just said, who could write the strongest proposal? Our goal was that we would write the proposal together, so that we have the people who have done in the past and can do that. We just wanted to know if we should lead out as a lead agency, since we're the smaller agency. But that's extremely helpful. So thank you for that feedback.
Sure. And Jason, any other questions?
At this time, Marianne, thank you for your questions. Right now, the queue is empty. Do you still have time for questions, Jay?
Well,
we have a few minutes.
Yeah.
I can remind everyone once again, ladies and gentlemen, if you do have a question, the lines are open and the queue is empty, so press *1 on your telephone keypad if you have a question. And we did have one that just came in, coming in from Kyron Jackson. Kyron, please state your question.
Hello. Yes, I am a leader at a local faith-based organization, and we have a very large constituency. I am recently responsible for a Fatherhood initiative, in which I'm trying to partner with a researcher to gain access to grants and funds. Being a new in a starting position, what is your recommendation to organizing this ministry to best partner with and or gain access to grants to structure it in the best way possible?
Kyron, is your question about how to locate an appropriate researcher for an evaluation? Is that what you're asking?
Yes, and yes, primarily.
Okay, Jennifer, do you want to talk about that?
Sure. I mean, I think, as you said, you're in the earlier stages, and similar to the answer that was given for the prior question, I think finding an evaluator partner at this early stage would actually be helpful in as you think about how to move forward to pursue funding. I think local universities are a great resource, and often folks are networked in with other evaluation shops that may be freestanding or a little bit more difficult to find. So if you can start having those conversations, and then also I'll circle back to a point that was made earlier about collecting data. You said you have a pretty large constituency already, or maybe working with a lot of people, starting to collect some basic data on who you're serving and which services are reaching which constituencies, and that kind of information will help an evaluator get to know you and what you're doing currently and what you'd like to evaluate in the future.
Yeah, thank you for that. The reason I asked primarily is because we have about 5,000 attendees, and I have access to about a pool of 500 fathers. We can see that commonly on any given week, and I just see that sort of access to a pool as being a high demand. So I was wondering, I think that's a great suggestion to go to a university, and I'll also try the resources that were given earlier in the slides through the website. Thank you.
Yeah, also, Karen, it can be pretty daunting to try to know where in a university to approach someone. How do you find a researcher? How do you find an appropriate researcher? And that's where the FRPN can be helpful. We have several resources that may be helpful. One is our listserv. So if you're signed up for the FRPN, you can join the listserv and possibly seek out a researcher that way. Also, you can contact us. You're more than welcome to contact us because we certainly know a lot of researchers around the country and might be able to direct you to someone who would be a good match for you.
Thank you. I'm on the listserv, and I will try that. Thank you.
Okay. Jason, any other questions?
Yes, we do, actually. We have another one coming from Marianne Porterfield. Marianne, go ahead and state your question.
Actually, the gentleman that was just prior to me asked my question, and so I got the answer. Thank you.
Any other questions? We've got, I think, time for one more question.
At this time, it looks like there's no further questions, actually, in the telephone queue.
Okay. All right, so let me just take this opportunity to thank the panelists for joining and for your really excellent contribution. It was very, very informative. I learned a lot myself here, and want to also thank those who joined us and put up with some of the technical difficulties, so hopefully we will be able to straighten those out the next time. But we will, in the future, have additional webinars, so please stay tuned for those. Jessica, anything that you would like to add?
No, I think thanks so much to panelists and for everyone who's joined. This will be posted on webinar recording and the PowerPoint on www.frpn.org, and we look for another webinar in 3 months, and we'll be announcing another salient topic. So have a great day, and thanks again for joining.